Do polyps always cause stage when colorectal cancer? Do polyps always cause stage when colorectal cancer? This is a question that many people may have when considering their colon health. The short answer is no, polyps do not always lead to stage 1 colorectal cancer. However, it is important to understand the relationship between polyps and colorectal cancer. Polyps are growths that can form on the inner lining of the colon or rectum. While most polyps are benign, some can develop into cancer over time. Specifically, adenomatous polyps, also known as adenomas, are considered precancerous. Research shows that approximately 75% of colorectal cancers start from these types of polyps. However, only a small percentage of adenomas actually become malignant. The risk of a typical colon polyp turning cancerous is estimated to be about 8% over 10 years and 24% over 20 years. This means that many polyps do not progress to cancer. Stage 1 colorectal cancer is defined as cancer that has grown through the innermost layers of the colon or rectum, while but has not spread to lymph nodes or distant sites. It can arise from cancerous polyps that have invaded deeper layers but have not yet spread further. In some cases, cancerous polyps, also known as malignant polyps, can be completely removed during a colonoscopy through a procedure called Polypectomy. If the cancer has not invaded deeply or spread beyond the polyp, this removal may be curative. It is essential to understand a few key points. First, while polyps are common and mostly benign, some types, particularly adenomatous polyps, have the potential to develop into colorectal cancer if left untreated. Second, not all polyps cause cancer, and not all colorectal cancers come from polyps that are detected or removed. Some cancers may develop without a clearly identifiable polyp stage. Stage 1 colorectal cancer often involves cancer that has grown from a polyp but remains localized within the colon while layers without lymph node involvement. Treatment for stage 1 cancer typically involves the removal of the cancerous polyp or the affected section of the colon. In many cases, surgery alone can be sufficient for treatment. The prognosis and treatment can depend on various factors, including whether the polyp was completely removed, the histological features of the cancer cells, and whether there is vascular or lymphatic involvement. In summary, while many stage 1 colorectal cancers develop from polyps, polyps themselves do not always cause stage 1 colorectal cancer. Regular screening and removal of polyps are crucial for preventing progression to cancer and for detecting cancer at an early, treatable stage. Always consult with healthcare professionals for personalized medical advice and to understand your individual risk factors.